It's a beautiful journey. I don't know how many of us feel, I know we are from Mount Kenya region and we region, but how many feel that you'd love to go just get on the boat, uingie tu kwa meli, upotelee kwa maji for 1 month? How many would be open to do that? 1 month, no phone, no Wi-Fi, just in the seeing and going. Beautiful thing. Let me see once again by a show of hands. There is one person in that particular cruise, ladies and gentlemen, who takes stock of that particular journey. As you are lost in sea and you are going, there is a captain who is always taking stock of where we are going and how far I've come in this particular cruise. Ladies and gentlemen, in the smart application cruise, there has been a journey. We want to understand how this journey in the last 21 years, to better understand it, to appreciate it. The man who is going to guide us on this conversation shines as a beacon of operation, prowess, and strategic leadership at Smart Applications International. This man has over a decade of experience and has consistently propelled the company to unprecedented heights. In every chapter of his professional journey, he has exuded leadership, innovation, and a relentless pursuit of excellence, from spearheading the seamless operations and customer-centric approaches to driving innovation and process efficiency. He is one man who is a visionary leader who continues to shape the course of business and inspire his peers, the captain himself. Ladies and gentlemen, it is my esteemed honor to invite on stage once again the Group Chief Operations Officer at Smart Applications International. You know him, you love him, and you've heard him. Please put your hands together for the one and only Mr. Isaiah Mosiori as he comes back on stage to guide us on how this smart application journey has been. Makofi tafadhali, as we say in Swahili. Welcome, and over to you, Mr. Mosiori.
Thank you very much. Good morning, ladies and gentlemen, once again. Good morning. I thought I've been here for just a few years, but when I was going through this thinking through yesterday night, I've been in this space for over 2 decades now. 2 decades, actually, more or less, with smart applications. So that's the journey I want to take you through in terms of who Smart is, how we have come along, what it was like almost 20 years ago, and what we are now, today, as you are part of us, celebrating the success with us. Smart is over 20 years, 21 years now. Guys, put our hands together so you appreciate the journey that Smart has gone through. And more importantly, put it because of yourself, because you're part of this journey. All right? Let's put our hands together once more. We could not be here as Smart without you. It has all the way been you and us in this particular journey. Smart Applications, 21 years down the line today. We are in 11 countries, covering East Africa, Eastern Africa, Central Africa, going to the south part of Africa, all the way to the western part of Africa. And as we speak today, we're impacting over 1.6 million lives. And as we speak today, we are in over 7,000 healthcare facilities. I know right in the room today, we have about probably 211 of you here, facilities. But beyond the 211, we have other 6,700 facilities out there that Smart has impacted. We have worked with over 6,000 organizations, corporates, companies, institutions, impacting lives. And we have seen savings on operational efficiency and some of the solutions we shall take you through we have seen impact, real impact. People coming and saying, you know what, I used to stay in the facility all the time, but now because of your system, this is what it has done for me. I don't have to be there. Processes are running. We are able to operate. We are able to do ABCD because of the solution that SMART provides. Beyond that, we can say with a lot of confidence that SMART does not just touch lives by saying it. As we speak now, confidently, I can say about 850 patients or clients, whether it's in Lusaka, Zambia, whether it's in Douala, Cameroon, whether it's in Kampala, Uganda, whether it is in Kwale. Right now, as we speak, they are interacting with our solution. Because we are very deliberate in terms of ensuring that we enhance the patient access, the journey, the convenience of accessing healthcare. Before then, what would be the scenario? For those of us who are not Gen Zs, I would remind you how it used to be. You go to a hospital facility, what they'll start asking you is, who has covered you or under which cover? Then you have to bring your birth certificate, your grandmother's, many documents, right? And today you don't have to do all that. You just come in, just tell you, put your fingerprint, and we are able to give you service. Is it not amazing? Pretty amazing. And you are assured somehow that indeed this is the bona fide patient, this is a bona fide member that you are giving services to. Rejections were above the roof at the time before solutions like such. But now we can talk about rejections probably being much below 2% or 3% because of other rules that necessarily are not identification related. So as SMART applications, what has our journey been? Having been registered in 2003, which is about 21 years ago, in 2004, we were able to have a very clear solution that we were establishing, a biometric medical management platform. And in 2006, I can say this with a lot of authority that we were the only organization that was able to have a solution running across the region, across the country with a robust network. A claim can happen in Mandera Agmat and you see it in Nairobi, Kenya Power, seated in an office. Because we are able to link facilities with the payers. Your claims were able to be transmitted at that time. And of course, in 2009, we can talk of coverage across the 47 counties. That time, we are not talking about counties. Actually, there are districts and what? And provinces. So that has been the journey. An amazing journey indeed. And so beyond that, because the solution is not just for Kenya, it's beyond Kenya, this has been our journey across the last decade. In terms of our spread, in 2010, we set up in Uganda. Right now, I can tell you with a lot of confidence that the SMART solution is even more in use in Uganda than it is in Kenya right now. Because of this solution, because of the benefits healthcare facilities are harnessing from our solution. We went into Tanzania in 2012. We went into Rwanda and South Sudan in 2013. And right now, there is no medical administration. There is no access in South Sudan hospital without SMART. They cannot operate without SMART. We went into Zambia in 2017, set up offices, and that's one of the most extensively used countries where we have our system extensively being used. We went into Somalia and Malawi in 2020, just within COVID. As much as COVID really did a lot of impact on us, we did not relent in ensuring that our solution is in use to ensure that we have seamless access across the healthcare facilities. And at that time, I remember the question was, do we still use fingerprint or do we touch or do we? And at that time, we provided an OTP solution. And I believe most of us now have such a solution also available as an option, maybe also for biometrics. In 2021, we set up in Cameroon and DRC. In Cameroon and DRC. And in 2022, we set up in Mauritius, is our youngest. And we continue to provide our solution across the board. So in a nutshell, this is my last slide. In a nutshell, what have we done as smart applications across the 2 decades? 2 decades. We were able to do cross-border access in 2014, which means that you can be able to access not only in Kenya, but with the same cover, you can access in Uganda, you can access in Lusaka, Zambia, you can access in South Sudan, in Victoria Hospital. You can be able to do that. We were able to be recognized by Oracle as an ISV vendor. And I can tell you, Smart has invested heavily in data protection. And we shall hear that conversation as we go along. We also provided an access control and time attendance solution. Some of us, sometimes we want to know whether our employees are at work because sometimes they are not in, or sometimes we want also to secure some of our resources. Maybe it's a drugstore, but you want to be sure who came in, you know. And so we have a solution, and we have done this across the region. And I'm sure some of you might be talking to us in terms of how can we work together in terms of providing you with this particular very, very important solution. And very exciting. This is the most exciting, and I can retire after this. I can retire for sure. Having worked with Smart for 20 years now, almost, I can retire, 2 decades. Smart, having walked with you the journey for more than 13 years, for more than how many years are those? 7 plus 17 years, by 2020. We understood you. We were able to look and see how you do business. We are people who are partners in your space. We have been seeing the issues and challenges we have been having in the healthcare industry. Today, as we speak, we have over 400 HMIS providers in Kenya, 400 of them. 50% of those, do you know where they come from? They come from where? 50% of them come from another country, right? A different country. But a number of them come also from this country. One of the things we have deliberately done as Smart Applications is to study our processes, is to provide responsive solutions, local solutions, solutions that are talking to a particular needs in Nyeri, particular needs in Karatina, particular needs in Kerugoya, particular needs in Mumbwini, right? Because we know you, you know us, we are partners. Because one of the challenges, if you look at stats, and allow me to say this with a lot of confidence because we have some of the stats, Kenya is losing millions of dollars to solutions that have been bought from outside this country. Once they sell to you that solution, what do? They land in, they come, they implement the solution. Next week, they fly out. What happens after that? You are looking for them to come and what? Support your solution. Do you find them? More often than not, you don't find them. And if they come in, you have to pay through the nose for them to customize. Just move this button from the left side to the right side. Make it blue. Don't make it yellow because my county is not a yellow county. Just to change that, they come and bill you in dollars, right? But who is smart? We are with you. We are partners. We understand you. We want to walk the journey with you. As we speak today, over 100 healthcare facilities are using our solution. Guys, let's put our hands together for Smart Applications. So Smart Health is one of the solutions we shall take you through. And indeed, we are very keen to work with you in this journey and deploy all innovations. Make it easy for you at the end of the day. And one of the solutions we have, or one of the elements of our solution, is to make payments very easy for you. So talk to us. The solution is pretty affordable, very easy, efficient, flexible, innovative, and what? You can add the rest for you. In 2021, we launched Smart Analytics, a very, very interesting solution. The one is using data to make decisions. Did you know that? Currently, we are using data to make decisions. When we were coming into Embu, Google could tell me if you use this route, you will delay by 20 minutes. What were they using? Do you know what they are using? It is what? It's data. If I was running an optical clinic here in Embu and I wanted to move to Kerugoya, what do I do? Do I go to Amuganga somewhere and ask him, what do you think? These guys, do they need some optical solution? What do I need to do? I need to engage what? Data. And Smart, as we speak, are the only organization in this country that has the reach we have and has some data or some semblance of data that can confidently give you elements to make that decision. And we have worked with institutions, and basically they have been able, some of them, to roll out clinics, to get outreaches because of the data that informs where next and what do the customers want. And of course, but do we say we are ISO certified? So we are not just a local institution, we are globally certified for security. We are globally certified for business continuity. Right now, we are just at the tail end of globally being certified for what we call the ISO 9001 for the systems. So you are in the right hands. You are working with the right people. It's not a startup of yesterday. It's an institution that has a solid ground that understands you and walks with you in this journey. And of course, in 2023, thank you very much. You worked with us in this journey. We were able to roll out what we call the smart access. Some of us call it virtual access. Some of us say cardless system. That's what we were able to do in 2023. And as if that is not enough, there are many things, and they're going to be mentioned this morning in terms of what Smart has done and what Smart wants to do. Actually, it's already in the kitchen. It's being supplied almost. It's being served. And that's one of the things, some of the things we shall be seeing just in a moment. Otherwise, thank you very much, ladies and gentlemen. Let's put our hands together once again to appreciate you for working with us in this journey of over 2 decades. Thank you very much. Over to you, Ian.
Thank you, Mr. Isaiah Mosiori. Let's appreciate our COO one more time with a round of applause. And thank you for helping us appreciate the smart applications journey, the innovations that have been there year after year. And definitely we're looking forward to what is in store, especially even as we move forward. At this particular point in time, ladies and gentlemen, we would like to call distinguished guest. Actually, he is our host right here in this particular county. He is the CEC, Department of Health at the county government of Embu right here.
Mauritius, which is our current newest country, we have currently set up in 5 providers. That's why a lot of you will get patients coming from Uganda with the same card, and then the card automatically will work. And optical facilities, and I am trusting Dr. Gaido and Kirimara Optica, you guys are enjoying these services where you now don't have to do the manual pre-auth process because the process is currently on the smart system. We also were able to introduce our EDI process. We continue to enhance that process where now you do not have to manually submit the manual claim form to specific underwriter. Like Old Mutual, it's purely paperless on the smart platform. And we continue to onboard other payers. We onboarded Air Insurance. We also onboarded Britam Insurers into that process. And as we do that, we just want to continue enhancing the process and to make your work very easy. So we have also given you a very good paperless process, of course, through our EDI platform. We're able to have visibility on your entire claim journey. You're able to track your claim process. You're able to track your payment process, and you're also able to get feedback. I know we are still working on the feedback process, but like has been said before, we are coming up with new innovations where you're not able now to only know that I've submitted these particular invoices to this payer, but you're also able to get the status of how far is my payment through that smart platform. We have also done automation at our healthcare providers. Throughout our 21 journey process, we're able to study the pain points that hospitals go through. And that's why we came up with an innovation of the Smart Health Plus ERP, which we will be seeing soon. It's actually an ERP that has been developed with providers in mind. It has really taken care of what exactly are the pain points with current systems. And we will be seeing our offering. Currently, it is now in 101 providers in Kenya, the likes of which hospital is this? In Karatina. I'm forgetting that hospital. Are using it? Jamii, yes, Karatina are using it, and many others. Kirugoya Fortis use our ERP. Hospitals in Moyare, hospitals in Garissa. So we are currently in 101 service providers, and we will see that, and we will see why you should actually be our partner when it comes to Smart Health Plus ERP. We were also able to go virtual, where we introduced our Smart Access solution, where we migrated our members who are on the smart platform onto a virtual card. You don't have to ask a patient to give you a physical card. They come, and then through the smart app, they're able to initiate the visit, and you're able to search them through the smart system, and you're able to get their virtual details on the card. We have also an offering for our data insights, which we shall be looking at this morning, that is actually able to give you informed information on decision making. I'm always asking provider, how are you carrying out your expansion strategy? How are you making sure that you're profitable? So that you are, Dr. Gaido, you're not going to Moyare and there is no business there. So we inform healthcare service providers that if you're looking at opening 10 clinics, why should you go to Embu? Why should you open your next clinic in Karatina? Which services should you bring there? Because what our data tells you is that this is the most prevalent diagnosis probably in a particular areas. This is what is highly consumed in this area. This is the payer who belong to this area, because we have had data for the last 21 years. So we give insights for you to be able to make informed decision. Because I had a story that somebody got paid 25 million from NHIF from the village, and the only thing they do is open an ICU bed. One ICU, why would you do that? Maybe even you don't get patients to use that. So you don't get into very expensive investment that are not actually going to be profitable. So you're able to give you data and insight on customer feedback, who pays when, who is not a good payer, who is the best payer. So all that is information we're able to give and track for you. System user behavior. We're actually now going forward, coming up in an innovation where you'll be able to register your users on the smart system, so that you can be able to know who is the user who is not completing billing, who is the user who is always capturing the wrong diagnosis on a claim. You know, there is that diagnosis list on smart system. So who captures abnormal diagnosis on every patient? The patient is coming for malaria, but you're only capturing the one line because it's the first one. So we're able to tell you what your users are doing on the system, who is actually not giving us itemized bill because it's a requirement for our claims to be payable. So really, this is what we do for our provider. We do much more, and we are going to be seeing a lot of innovations that we're going to be releasing in the next near future. So our current products, our current product that is running at our healthcare providers, the first one is the MediSmart. This is our automated biometric-enabled medical management solution that also houses our ADI platform. This was what we started up with. We were able to roll out the card reader, the fingerprint reader, but my dream is now to actually give the hospital a one gadget solution. So you guys are always saying, bring us only a fingerprint. See, deal, we are headed there. So we are on a journey to make sure that everybody is onboarded on virtual, so that we can make your processes easier. I know it sometimes can be overwhelming because you're connecting so many gadgets, but as smart, you are working to make sure that that process is very efficient. A lot of our processes, currently we may have the consolidated systems, but we want to house them in one single platform, which is what you're going to be seeing us coming soon to ask you, can we do an upgrade? And please support us when we come, because we're coming with a very, very beautiful new innovation. Our Smart Health Plus ERP, which is a comprehensive hospital management information system. This is a system now is going to the third year. Of course, our first year was a running process where we actually wanted to understand what our providers need. So it's an ERP that is very provider driven. It's an ERP that can work for a small clinic. It's an ERP that can work for a level 4, and it's an ERP that currently can work for a level 5 and level 6. We are currently implementing in a big hospitals. We are not shy to say the product is ready for anybody. So we also have our smart time and attendance solution and access control that you're able to manage the shifts within a hospital. Hospitals have crazy shifts. Maybe you have 3 shifts, 4 shifts. So our smart time and attendance is able to do that, and also monitor when your staff come in and leave work. And if you're computing overtime through payroll, it's actually an automated process that does all that, and of course has very good reporting. And then our product for smart analytics is our business intelligent analytics tool for medical insight and data-driven decision making. I say this is any CEO who wants to run a profitable organization. This is a solution you cannot not have. If you want to run a healthcare service provider and become profitable, because what they say is that running a hospital is very expensive, but don't make mistakes in that process. Know what to do where, know where to go where, but let data inform you. So we'll be giving you a lot of insights today. You will see which is the best performing county in this region, what is the most prevalent ailment in this region. We'll be able to see a teaser of what we have, but we are really asking for you to come and have a conversation with us so we can be able to digitize you and we can be able to automate that process. So basically, that's what we do for our healthcare service providers. We do much more. But today we came to make sure that you understand. Smart sio ile smart ya kidore peke, because people always say ile ya kidore. No, smart is so much more than that. So thank you so much, Ian. I'm happy to be. I come from this region. Where is Kiriaine Mission? I know they were invited. Are they here? Or they're still coming? That's my village, but I know they will be here. So it's an honor to have you guys.
The beautiful thing that I love about Esther's presentation is the transformation that keeps on happening at Smart Applications, and also definitely staying afloat and staying ahead of the game when it comes to bringing the innovative products into the market. So I can guarantee you, you are in absolutely good hands with Smart Applications. Bwana Waziri, your county is in good hands with Smart Applications. Please, let's appreciate Esther Masharia one more time with a round of applause. Thank you, Esther, and thank you for your leadership. Now we want to go into our next discussion, which is on smart health. And to guide us on this particular conversation, ladies and gentlemen, is a man who is results driven, and with over not just 5 years of experience, but over 10 plus years of experience in ICT industry. And he specializes in sales, customer service, and support, and also implementation. This gentleman has a proven track record of driving the business growth and also ensuring customer satisfaction and leading successful project implementations. One of the things that I appreciate and admire about this gentleman is that he is an excellent communicator, has strong IT expertise, and he is passionate about delivering exceptional customer experiences. He is a sales manager at Smart Applications. Ladies and gentlemen, help me appreciate Mr. Justin Mugi as he comes forward to give us his presentation. Justin, we are glad to have you here and we appreciate your expertise. Makofi tafadhali ya Justin. And as Justin is setting up, please, I'd like to request if we can be able to have the Mentimeter code on the screen. If our technical team is ready, the QR code. Just want to confirm, yes, if we are ready. This is for Mentimeter. How would they access it? Is there a QR code that we can give them in terms of accessing it? We have a platform where we have certain questions that are there, and we would like you to chime in and also engage us on this particular platform for the QR code. Okay, I guess we can, we'll do it. Maybe we can prepare it well before Justin comes in or after Justin comes in. The Mentimeter is a platform where we have set some questions in there. It's an online platform that we want to interact with you in that particular platform. We have certain questions that we have set in, and we want to engage on those questions towards the end of the program. Tukiendelea kumalizia katika hiyo platform, tunataka kuzungumza na nyinyi ili tuweze ku-engage on those particular conversations. So that is a platform that has been prepared for you. But we'll do it, we'll guide you later on this. At this particular point in time, I want to give the opportunity to our sales manager, all right? Okay, I can see the Mentimeter is ready. So are you familiar with the below Smart Solutions, that is Smart Link and Smart Health? So to join it, you can go to menti.com. You can just take out your phone, go to menti.com. Menti.com, just get out your phone, go to menti.com. And then once you get to menti.com, technical team can guide us to have the code on the screen so that now once you get to menti.com, you use the code 4705 6045. I'll give it again, 4705 6045. And then the questions are in there. We just have a few questions that you can be able to answer. Are you familiar with the below smart solutions, the smart link and smart health? Then now we can be able to proceed from there, okay? All right, and we can be able to see, this is the real time that we're already seeing people already logging in. We can see 6 people already on SmartLink, 8 on SmartLink, 6 on Smart Health. Fantastic. So please, this is the platform that we shall continue just giving you more information as we proceed. Get into menti.com and then we shall stay engaged. At this particular point, ladies and gentlemen, I would like to request that you lend us your ears as we hear from our seasoned sales manager, Mr. Justin. Please, let's give him another round of applause as he gives us his presentation. Welcome, Justin. We are glad to have you here. Karibu sana.
Thank you very much, Ian, and good morning, everyone. So as the screen comes up, we are glad to have you here today and to present to you our Smart Health Plus Hospital Management Information System. It's a web-based application that can help you manage your healthcare facility and track the journeys of your patient. It can also help you to improve the patient experience and, of course, to digitize your health records. So this system, as it has been introduced earlier, is internally developed at Smart. It's one of our newest babies. And we are going to show you how, making use of this particular system, you're going to derive the best for your healthcare facility.
As we get ready, there's something that, and I was reading the profile of Justin, but there's something that fascinates me. And Justin, I just want to ask you one simple question. What inspires you to do what you do every day? 10 plus years of experience, expertise in ICT and passionate about it. What gives you the fire to do what you do every day? And also, most importantly, at Smart Applications, if you'd be so kind as to share with us.
Thank you, Ian. What inspires me is the passion. The passion gives me the drive every day. And in every step, when I make a win, it keeps me going.
Final question I'd like to ask Justin, and I know this is an open-ended question, just throwing it in there. Is there a fear that you have, especially when it comes to the ICT expertise? There's something that wakes you up at 2 a.m. that you think about. Is it about being hacked? Is it about losing sales? What is the one thing that would wake Justin at 2 a.m. in the morning?
What wakes me up early in the morning is when I'm thinking about the next question. As an ICT expert, you find that I'm mostly working in the healthcare industry. And of course, healthcare has its own language. So I would wake up and think, today if I do a presentation, what if you ask me something very technical in the healthcare world that I don't know? So that will wake me up, it will get me to researching so that I can be able to understand and relate with what you will be asking me. Thank you very much. So as you can see from your screens, this is our system, the Smart Health Plus Hospital Management Information System. And it's a web-based application, as I had mentioned earlier. And we are going to go through the process and highlight the areas in which this system will come in handy to be able to help you to manage your healthcare facility. As Waziri had mentioned, one of the most important things nowadays is the sharing of information. It's also one of the key areas that the governments are looking at, both the national and the county government. And that's why on our system, we have a capability called the multi-tenancy. So multi-tenancy is what Waziri alluded to, meaning that you can be able to manage information centrally. Let's say you have a number of facilities and you need to manage that information centrally, and of course maintaining some level of semi-autonomy, you can be able to handle that. So you will be able to log in as per the facility that you'll be operating from. So, and the first thing that you'll be able to get is the dashboard. The dashboard is very, very important, especially for facility administrators, because this gives you a highlight of what is going on at your facility. Today we are seated here, and I'm sure you have roles that you play within your healthcare facility, and you'd want to know constantly what is happening. And considering that these are web-based applications, you can log in from anywhere on the globe, and you can be able to tell that currently you have this number of active patients on the queue. You can see the appointments. You can be able to see the total number of patients. This is the distribution of all your patients. And of course, the distribution is as per the gender and the age brackets. You're also able to see if there are any new patients that have been recorded. And this information is streaming in real time. Then you'll be able to see the revisits. And you can also be able to see the distribution of the same using the gender and the age brackets. Then you're also able to see the locations where your patients are coming from. As we said, data is very key. So if today you want to know where your patients are coming from, you'll be able to tell using the data that already exists in your database. Thank you. So you'll be able to see where your patients are coming from. And of course, as you register these patients, one of the key fields is the location of those patients. You might find that there's a certain area that you didn't expect, but you're receiving a lot of patients from that side. So what you'll do with that information is probably decide on setting up a facility nearby. Then you can also see what is happening in the inpatient side, where you can see the occupancies. You can be able to tell what kind of beds you have and how occupied are they. Then in terms of the clinical, sorry, the technology today is I think that can do now. So apart from that, you'll be able to see the clinical aspects of your operations. So you'll be able to tell in terms of the common illnesses, you can see the diagnosis against the age brackets. You can also see the visits by gender, by type of visits, the status of those visits. You can also see the various visits per clinic. I'm sure in some of the facilities you have more than one clinic. So you can actually track what visits you're receiving from different clinics. You also be able to see the requests that are coming through from the doctors, and then the request and the status of those requests. Because it's one thing for the doctor to make a request, and it's another one to have it fulfilled. If today the doctor requests that I have a lab test, what is the likelihood that that request will not be fulfilled? So you're able to see that information. Then the dashboard still comes and shows you the patient by clinic and the referrals. So it was also mentioned, it's very important to know the information about referrals. Referrals can be internal and they can also be external. You can be referring to an external organization. You can also refer internally. Then requests per doctor, you can tell, you have your doctors registered on the system, and you'll be able to tell how many requests a doctor has made to a particular department. Then you're also able to see the patients by doctor. This is more or less to see how many patients a doctor has seen at any given time. So this information comes in real time. Then, of course, you're able to see the diagnosis. So you can actually track and see the commonly dispensed drugs against the diagnosis. So you'll be able to tell what are those common drugs that are dispensed, and of course you will compare that information with the diagnosis and find out whether there's a correlation, of which more often than not, the diagnosis and the dispensing of drugs, there should be a line that connects the two. Then in terms of the stock and inventory, the system will track your inventory in real time. You can tell how stock is moving. And of course, at any given point, when the dispensing is happening, you'll see how the stock is moving. And of course, you'll also be able to know the values of that particular stock. In terms of financials, you're able to see the debtors, the remittances, and this information again is streamed in real time. Then the top 5 payers, you can track your payers, you can track the invoices and the status of those invoices. You can also be able to know your creditors and how well you're doing in terms of paying your creditors, the collections that you're doing daily. So you can actually see the daily collections and then collections per cashier. Of course, every cashier will be registered on the system and you can see in real time how much they've collected. And as we proceed, you're going to see how you do reconciliations at the end of a cashier's shift. Then collections per payment method. There are various methods of payment. Some people will pay using cash, others will pay using M-Pesa. So that information will also be displayed. So basically that's a highlight of the dashboard. And apart from this dashboard, the system also has comprehensive reports. If you want to drill down to a particular report, the system will be able to give you that, as we're going to see as we proceed. Then going into the operations of the system, you'll be able to manage your patients when they come in under the patient management module. So the patient management module is where you're able to register your patients, is where you're able to retrieve the patient information. Assuming I've come into your facility and I'm coming in for the first time, you can create me as a new patient. But if I'm already an existing patient, you can actually be able to search my details. One of the key elements in this particular module is the aspect of the fingerprint use. So you can be able to register the fingerprints of the patients such that when they visit in the next, when they come in for the next visit, it will become easier for you to retrieve their records. One of the challenges that you've seen with the healthcare facilities, it has become a major challenge to maintain unique records of patients. So you find a patient is registered more than one because there is no specific unique way of identifying that particular patient. You can use ID, you can use the name, but we know more often than not, most of those methods may not work. So that's why we've introduced the aspect of the fingerprint where you can register the fingerprint. And we're not saying that it's the only way. It is to complement the already existing process. Then when a patient comes in and they don't exist in your records, you'll be able to also register their details. You can see some of the mandatory fields like the contact of the patient and of course the location. And this is where the system is pulling the information that has to do with where they are coming from. Then the casualty patient, the system can be able to identify a casualty patient so that they are queued under casualty and of course emergency. Then under patient queue, the system is able to show you the movement of the patient. Maybe if a patient comes in and they are moved from one point to another, the system will be able to show you a patient journey. And of course, it will also maintain a timestamp. This is very important because it gives you the capability to know the turnaround time. So you can track the turnaround time of your patients and you'll be able to know where you need to improve. Then you're also able to track the appointments. So under appointments, one of the key capability on this system is to send automated reminders. So if you already have an existing bulk SMS platform, you can be able to integrate to this platform so that you don't have to call the patients to come for appointments. The system will just send a message to that patient depending on the time that you've set. Then you're also able to manage gate pass. So if you have a requirement to have a gate pass, especially for discharged patients, it can be done automatically by the system. Then merge patient records. Going back to the aspect of fingerprint registration, you can be able to merge patient records. If you discover that there is a patient who already has an existing record, you can actually merge those records into one file. So under patient registration, when you activate a patient for a particular visit, when we pick one patient here just to showcase, you are able to get certain functionalities. You can, of course, select the type of service, if they are coming in for a consultation, and of course, the payment method. If this patient is paying through credit, the system maintains a history of what insurance companies they have been using, or what payer they have been using, so that it becomes easier for you to just select that particular payer if they have not changed from that payer, and of course proceed to activating that patient for a visit. Again, as you activate the patient for a visit, the system also allows you to send the patient to the different locations. You can send them to lab, you can send them to triage, depending on what service the patient has come to seek. So moving forward, there is a triage module. And the triage module, you also be able to track the time when the patients were sent to triage. And of course, you'll be able to enter the vitals of those particular patients. You'll be able to enter the vitals. Of course, it has the various indicators in case some of these things are out of range. The system will be able to show you that. And of course, it's also able to show you the history of those particular patient in terms of the triage records. And of course, if it's a credit patient, the system shows you the running limit. Running limit is to show you that if a patient has visited and they had this amount of balance, as they proceed, the limit keeps reducing, so that if you get to a point where the patient is about to exhaust their cover, you can actually alert them. The system will also give you an alert and telling you that this patient has exhausted their cover. Then under casualty and emergency, these are the patients that have been queued straight from casualty. They are those patients that have the accident and emergency side. Those hospitals, you can actually make use of this particular module to be able to manage such kind of patients. You can do casualty management. And of course, you can even allocate the beds that you have under casualty. Under consultation management, the system will be able to list to the doctor the various patients that are on the queue. So the doctor will be able to select the patient that is presented to them. And then, of course, they can be able to access the patient files. They can be able to view the vitals that has been recorded in triage. They can even add the vitals. They can enter the triage notes, allergies. They can see the allergies that were recorded and also add allergies. Then we also have the capability of doing a TB screening. In case probably you're suspecting TB, you can actually go ahead and do the screening. Then, as you proceed, you can enter the history and treatment, where you can enter the chief complaints of that particular patient, the social history of the patient, the historical notes of that patient, the surgical history, the examination notes, and of course, in every step, this system is able to maintain for you the records from the previous visit. So it will list for you all the visits that the patient has had, who saw that patient, and what was recorded. And in case you even want to go ahead and print out that, you can actually be able to do so. Under diagnosis, we have uploaded the ICD-11 codes, whereby you can either enter the code or you can type the diagnosis, and then it will be able to fill in the code. And of course, as you proceed, these are some of the areas where the system will be pulling the reports, especially MOH reports. They will be based on this particular information. Then under prescriptions, the doctor can actually be able to prescribe for that particular patient. And of course, as you prescribe, some of the key areas is that you can actually view the prices, and you can also view the availability of that particular drug. So as you enter this information, you can be able to pick out a drug, you view the price of that particular drug and the availability of that drug. Then you'll also be able to enter the various fields that have to do with the frequency, the duration, and of course you can go further if you had already sent that patient to the pharmacy. A pharmacist can send a change request where the doctor will be able to see a request that needs to be changed. Maybe at the pharmacy level, the pharmacist has noticed something that they need to alert the doctor so that they can be able to change that drug. So that can also happen. The system is also able to identify the service point, because you can have a number of pharmacies. Maybe you have one pharmacy under inpatient, you have another one under OP. You can actually identify where you're sending that particular patient when you are on this particular module of the doctor. Then you can make a request for lab, nursing. You can make requests for procedures and radiology. You'll be able to do those requests. And of course, if you have packages, you can actually configure packages, especially for the lab. You can also track consumables. This is one of the things that really is hard for hospitals to do, where if today a doctor gets a packet of gloves, how do you get accountability of how those gloves have been used? So you can actually track consumables under the doctor's module. And this also happens across all the other modules. So you'll be able to do consumables and provide accountability for the same. Then you can also do the referrals, the appointments. The doctor can set an appointment for the patient, can request for an admission. This request will go straight to the inpatient department. Then you can also make a theater request, or you can send the patient to casualty. The system also gives you a capability to go ahead and generate a medical report. Then under appointment, the doctor, of course, will be able to see the appointments they have. They'll also be able to, you can also expose these particular aspect of the reports, where the doctor can see how many patients they have seen for that particular day, or that you can generate over a period of time. Then the 6 sheets that the doctors have generated can be able to be seen, and you can actually go back in history and see how many 6 sheets have been generated over time. Then under nursing management, you'll get the requests, or you can also assign those particular procedures when you have the patients coming. So some of the key areas, of course, again, is to do with the consumables management. So you can actually see the item, and of course the price is already set. You can enter the quantities. You can also be able to, of course, the amount will be set. But in case you spend more consumables than the ones that have already been set, because initially, as a hospital, as you're doing the configurations, you can define for every particular procedure how much or how many consumables are you going to use. But that is not static, because in the process, that can change. So you can actually add more consumables on that particular view for that particular test. If you have certain procedures that are going to be done externally, you can actually have the supplier configured on that system. And you're going to see under supplier management how you're going to manage those suppliers that don't only supply drugs, but they also supply services. Then under lab, still under nursing, you can actually do the checklist. For example, you have daycare procedures. You can handle them under the nursing, and of course, you'll also track configure the consumables and the settings. So for lab management, you're able to receive requests from the doctor. Of course, these requests will be color-coded so that they can also show you the urgency of that particular request. Then you'll go ahead and do the sample collections. You can, the same case that happened with the nursing, you can see the consumables that have already been configured for that test. And if you use more, you can actually go ahead and add those consumables. Again, this system also gives you a way to print out the label for the specimen. So you can print on the label and also stick it on the specimen. Secondly, the system can also send alerts. So you can integrate it to the bulk SMS capability, because sometimes you'll find a patient will come over lunch hour and they are going to do a test. And maybe they have already gone back to their office and they need to be alerted that the results are ready. So you can set that particular capability to be able to trigger a message to the patient that their results are ready. Secondly, we have been able to do the integrations with the equipment for those tests that really have those particular digital equipment for reporting purposes. So it becomes easier for you to get that information. The lab technician doesn't have to sit there and, of course, configure that manually. Then, if there are any new requests that have been sent straight to the lab, they can come here and add the request. You can do configurations for specimen, the discipline of those tests, and test reagents. Of course, this is done at the initial stage of implementing the system, but it doesn't mean that you can't adjust it as you move forward. And of course, you can set consumables that are supposed to be done, to be used for every test. Then under pharmacy, you'll be able to handle drug administration. You'll be able to get to see the request from the doctor. You can actually go ahead and do the process of dispensing. So as you dispense, you'll be able to see that particular drug. You also see what is available in that store, and you also be able to go ahead and you can request the doctor to change, as I mentioned earlier. If you want the doctor to replace this and you press this button, the doctor will receive that notification on their side. Then you can also be able to track your batches. As you're receiving stock, you will do batch numbering, and you receive that stock using the batches. So as you're dispensing, it's important to track those batches, because you don't want to find yourself in a situation where you are dispensing the new stock before you finish up with the old stock. Of course, you can also be able to print out the label, so you don't necessarily have to write it on there. Maybe if it's an envelope you're using, you don't have to write it manually. You can print and stick it there. You can also handle drug administration at a pharmacy, especially for patients that are on continuous treatment. You can do drug refills and such. Then you can also be able to track the history of dispensing and refills. You'll be able to handle refills on this particular system. Under radiology management, you can get the request from the doctor. You'll go ahead and handle the registration, the study, and of course the reports. So one of the key elements here is you're able to upload the medical templates, so that you're able to, the person reporting, the radiographer or radiologist will be able to enter that information. Then, of course, consumables is also handled, as I mentioned. Apart from those basic modules of operations within a hospital, there are other key modules that help in the running of the hospital. There are modules like the optical management. If you have some patients that are coming to pick glasses and such, you can actually handle optical on this particular system. You'll be able to see the optical sales. You can be able to handle pre-auth on this particular platform. Then there are those services that are continuous, or those services that you have to visit more than once. For example, if you're doing a root canal, you don't do it once and then the patient goes. The patient will come for a number of visits. So you can be able to have a treatment plan. This treatment plan shows you the sessions for that particular patient, what they have attended and what they have not attended. And of course, the treatment plan dashboard, it will show you, this is the patient, the total sessions that they have been assigned, what has been completed and what is pending, and the status of payment. Because if I'm doing a root canal, I may decide to pay everything at the beginning, or I can pay as I visit, or depending on how you want to stagger the payment. You can handle that on this particular platform. And not only on dental, you can also handle aspects of chemo, renal management, all those services that require a number of sessions to be handled. We're also handling the aspects of ANC. You can handle maternity aspects, and of course, pediatrics. You'll be able to do so on the system. So you can see the waiting list, the immunization request. Of course, under maternity, you can also handle aspects of childbirth. As per that particular book that you usually have for ANC, that is what the system is reflecting. Then we have specialized modules like the dental management, where you can handle dental consultations, the requests, the sales, and of course, the consumables. Cancer care, you'll be able to handle aspects of cancer care, where you handle the consultation, the request, and of course, this is where now you generate the treatment plans. Physiotherapy, you can also do the same, and you can also do the treatment plans for physiotherapy. Then renal is also the same logic. Then we also have the mental health management, where you're able to do the psychiatry management, where you can be able to go through the process with this particular patient. You can do mental status, the examination, and of course, it has to be specific. You must have logged in with your specific account, because this one requires that not everyone is able to access this information. Even if you also are a specialist, unlike the other one where you can do consultation, one doctor can do consultation, and that information can be seen by the next doctor. For mental health, is a bit more strict in terms of the exposing that information of the patient. Then you're also able to handle counseling aspects. So you'll be able to do counseling. Then under inpatient management, the system allows you to handle admissions. You can be able to get the request that I mentioned from the doctor side. There you will be able to see the request, and then you can act on those requests. These under now the inpatient, the ward management, then nurses within the ward will be able to handle the aspect of triaging the patient. They'll also be able to view the patient file. They can do the diagnosis, the nursing notes, the care plan, which is developed by the team that is taking care of the patient, the doctor's notes. Then you're also able to handle, and then there's something called doctor's instructions, whereby maybe the doctor requested that the patient to be taken out for 2 hours, maybe to bask in the sun. You can also be able to handle doctor's instructions. And of course, it will show you whether that was fulfilled or not. Then under disposition, you can be able to also do referrals and the request. So referrals, as I mentioned, you can refer internally or externally. Maybe I've seen the doctor, even under outpatient, and they realize that I need to see a specialist. They can actually refer me internally, and of course, I'll be queued in the queue of that particular doctor. So the system is currently handling the aspect of NHIF rebate, the discharge aspect, where you'll be able to see the generate the discharge summary, to do the diagnosis upon discharge, the prescription, the discharge notes, the appointment, of course, the sick leave. Of course, you can even discharge if you already have a morgue and you make a request for admission in the morgue. Then the system also, that's why we have the morgue management module. So the request can come from internal, can come internally from the inpatient department, and of course, you're going to receive those requests and admit in the morgue. Then ambulance management, you can handle your ambulances, the dispatches, and the settings. And of course, you can see whether the dispatch has been fulfilled or not. So under morgue management, you will see the morgue register, the requests that have come through, and you can go ahead and admit in the morgue. Then you can be able to discharge from the morgue. Of course, the settings that you have to do with the freezers and the room, the trays. Then under billing management, you'll be able to handle the patient bills. So you see all the bills for that particular day. You can go ahead and pick out a patient, and you'll be able to do the billing. So the cashier will log in with a PIN, because the system doesn't allow, even if you are the administrator, you need to monitor who has collected what, and there has to be a reconciliation at the end of the day. You have to log in with a special PIN to be able to handle that aspect of billing. And of course, you can also, your shifts end, you can do the reconciliation. So you can also be able to do adjustment of bills. And of course, there are times, especially for inpatient bills, I find a lot of adjustment happening in the hospital. Then you can go ahead and receipt. You can also do waivers. There are some things probably that you need to do a waiver for various reasons. Even at the county facilities, I find that there is a board that sits down to discuss patients who are not able to pay their bills. So they can also be able to do a waiver on the same. And of course, the system keeps giving you notification. For example, the system has a capability for payment. We know the kind of environment we operate in. So if probably you know this patient and maybe they don't have money and tell you they are going to bring in money, sometimes I see hospitals allow that. So what the system does to help you recover that money, when the patient comes in the next visit, you can actually, it can give you an alert. This patient has a pending bill of this much from lab and all those areas of service. So under this particular bill management, you'll be able to handle the aspects of cash, mobile. We've already integrated with M-Pesa. You can do either a TK push or just a normal integration. So then bank, people can pay through the bank card. This is not yet integrated, but you also have an e-wallet. E-wallet is where you can have a patient being sponsored. Someone can deposit that money and you hold it in a wallet. That wallet is what is being used to pay for those services. Or even patient make deposits. You can pay through the e-wallet. So, and the other aspects are like adjustment of bills. You can see any bills that have been adjusted. You can filter the period. You can be able to generate a draft bill. Now, a draft bill, sometimes insurance companies will ask you whether you will be able to how much you're going to charge for those services. So you can actually generate a draft bill more or less like a quotation, and you can see whether it has been proved or not. Then all the other aspects of billing, the history of billing, all those will be handled. Then back office operations, you have asset management, you can handle your assets, the depreciation and appreciation, the accounting management, where you set up the charts of account, the journals, you track the journals, the bank reconciliations, expenses and bills, all those areas will be covered. Shift management for cashiers, petty cash management, you'll be able to handle petty cash. Budget management, when you do your budgets at the end of the year, you can be able to handle that. Then human resource management, you'll be able to handle aspects that have to do with human resource, payroll, leave management. And of course, we are now coming up with the aspects of performance management. Then stock and inventory, you'll be able to track your stock. You'll be able to do the purchase orders, you do purchase receive, you can do stock invoices, the stock adjustment aspects, where you also do the stock take, the transfer of stock from one store to another. So the system treats every other department as a store where there are consumables being used. So you'll be able to track that. You can also handle stock returns, and of course, the approvals that go with it. You don't just transfer stock. There has to be a level of approval. And the supplier management, as I mentioned earlier, you're able to handle the aspect of the suppliers who are not non-drug suppliers. You can record those suppliers, then you do the purchase orders, the supplier invoices. You can see whether they are internally offered services or externally offered services, where you're talking of tests that you refer to other places, for example. Then supplier settings, you can set up all your suppliers and map the items that they're able to supply you. Then claims management, you're able to handle the aspects that have to do with invoices, amendment of invoices, merging of invoices, and then the system gives you an automated way of doing reconciliations, whereby if you're knocking out those particular invoices, you'll be able to do it in an automated fashion. Then you're also able to, we have integration with the teams, so you'll be able to generate these in-team compliant invoices, and of course even receipts. So this is already available. MOH setup, you're able to generate the MOH reports. This is where you do the setup, the mapping of analytes and such. And then under administration, as I conclude, you're able to manage your users and bots. As you've seen, this system has so many modules. Not everyone is allowed to access each and every module. So you'll be able to access this system as per your role within the facility and what has been assigned to you by the system administrator within that particular facility. Then you'll also be able to, just like on your phone, you're able to have settings. You don't require us every time you need to change to adjust something. We just train you on how you're able to handle these settings. All the aspects that we've been talking about, the settings of the same are available here. And the product and services, you define your prices. The system even goes ahead to do multi-pricing. So if you have particular prices for particular parties, you can actually do that. So you can have more than one price for the same service, depending on who is accessing that service. Then you'll also be able to upload the facility logo, and the system is able to generate all the documents as per your brand and the colors that have to do with your brand. Then under notifications, again, we are going heavy on notifying the patients. Apart from notifying them on lab and notifying them on appointments, you can go ahead and send them broadcast messages. For example, we are from a holiday that happened on Monday. So you'll be able to wish them happy holidays. You can send such messages. You can send targeted messages. Then automated notifications on emails. You can be able to handle them. And of course, you can see emails like alerts on expiry. Alerts on can be automated on there. Batch emails. You handle batch emails when you're communicating, especially your patients that need communication through email. A platform where you're able to see the business overview report, the patient reports, payment purchases report you need customized can be done. So this system, we are able to be very flexible in terms of payment. We have several models of payment. you can do payment. You can visit system per visit. You can also do a subscription model where you're able to pay on a monthly level a standard amount. So we are very flexible. We can do presentations, more detailed presentations. We can also be able to support you fully. As face is has to do with support. So we have a team of support that will be able to support you when you get this system, including if you want an adjustment, it will be handled. So thank you very much for listening. I welcome any clarifications that you may be having. I'll be willing to respond to you. Thank you so much.
All right, I know we are far stretched on time, but his presentation is quite important. We just want to open the floor to two questions, two burning questions that we can be able to tackle in the next 2 minutes, so that I can be able to bring the mic. You any questions from the floor? Any questions? I can see one. Is there anyone else? To the gentleman in brown, and we will take your questions concurrently, and then now we can be able to give an opportunity to Mr. Justin to answer that. There we go. All right, here you go.
Hello, good afternoon. My name is Maurice. My question is on reports. Can we be able to get the income statement, and because I've not seen on finance reports, I've seen on invoices. Yeah, the consolidated reports. Can you be able to get from the system?
That's the first question, and let me come to the final question. But the questions don't end here. During our breaks, we'll make sure that you can engage Justin. Here you go.
This is Duncan from CTI Hospital. I guess my question is related, but mine is more of the BD, like the performance of the facilities, daily, weekly. Can we get maybe even on the dashboard that kind of a summary where someone can pull a report, maybe for the team or for the whole hospital, majorly on numbers?
Thank you. Over to you, Justin.
Thank you very much for those two questions. So in terms of the reporting of financial activity, the system has, we are calling them the business overview reports. So you'll be able to get all those statements. The income statement is here. You can generate any report. And the beauty with the system is that we've given you a capability to select the dates. So if you want it, you want to know what happened for the whole period, probably from January to date, or maybe for a month, you can actually use the dates to be able to filter those reports. And I think that question is also related to the second gentleman who was asked, where you're able to use those particular filters to filter as per the date, including at the dashboard level. You can actually be able to do filters. If you want to see what has happened over a period of time, you can actually search as per date. So you can filter as per the date, and you'll get that information. So I think that's it. We can have further discussions. Our team is there. You can leave your contact. You can also interact during breaks, and we'll be able to respond to you. If you need a demo, you can also record with our team there. We'll be able to do a demo for you.
Great. Thank you, Justin, for that. And also thank you for chiming into the questions. Need to reiterate what Justin is saying is that we'll also have an opportunity to engage further on those particular questions. But about smart, it's all about smart, and Sante Sana, it's all about smart. Ladies and gentlemen, our next speaker is a man who has used the smart application platform not just for 5 years or even 10 years. He has used this for a period not less than 50 years. Ladies and gentlemen, he's also the former East African representative for the International Christian Medical and also Dental Association. He is a Gideon and a Red Cross Life member. This man is so holistic, ladies and gentlemen. You have no idea. He is an immediate former board member of the Presbyterian College, Rubet. And he's also, ladies and gentlemen, a board member of the Chogoria Mission Hospital, a board member of Gikurune Boys High School, an active elder of the PCA Church, and the chairman of the Ruaguene PCA Church, Meru West Parish. He's the founder, ladies and gentlemen, of Elephant Dental Teaching and Referral Hospital. He is the founding director, ladies and gentlemen, of and the CEO of the Elephant Dental Limited, with 45 dental clinics within the country. Ladies and gentlemen, up next to speak to us is none other than the seasoned, experienced elder, Dr. Pete.
Are you a hospital owner, medical entrepreneur, consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and safety, streamlined reporting and compliance, data centralization and analysis, finance and accounts management, are you a hospital owner, medical entrepreneur, medical consultant, practitioner tired of the hassles that come with managing your healthcare facility. Introduce Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boost your facility's productivity. You can digitally transform your health facility a click at a time. Smart Health Plus benefits include ease of use, scalability, and interoperability. Enhanced patient care and engagement, inventory and supply chain management. Are you a hospital owner? Newer medical consultant or practitioner tired of the hassles that with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility productivity. With Smart Health Plus, you can digitally transform your health healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. About Smart Health Plus, you can talk to us on email at provideradmin@smartapplicationsgroup.com. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introduce Plus, the revolutionary solution that elevates your patient care, billing, and boost your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Plus include ease of use, scalability, operability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boost your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability, and interoperability. Enhanced patient care and engagement, inventory and supply chain management. Enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis. Finance and accounts management. To learn more about Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance,
Please put your hands together. The one who also made it happen, and is also our host here, the one and only Mr. Caleb Masharia. Makofi tafadhali kwa Mr. Caleb Masharia. This is your region, and we are glad to be here. Karibu sana Mr. Masharia. Thank you for bringing us to Mount Kenya. Welcome once again, asante. Wish I had your number before my show. Thank you so much. Thank you so much for availing yourselves. Again, big numbers at the old school. And welcome to Mount Kenya Eastern Region. We're very glad that you are here. So mine will be very brief. I'll be presenting our value proposition. So, most of you I don't travel from far, but now you're at the levels I can see they are now back and we can continue the session. So the first point will be on smart access. Most of you also know
data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com.
innovation in the healthcare sector. Generally streamline healthcare delivery process, ensuring that health and care are properly integrated. So allow me to go through why we have decided to is going to be greatly eased, and the solution we are providing here is going to make your work so much easier and so much accurate. So why have we put AI in the system? Number one is to improve clinical decision. We have put a clinical decision support system that is going to ensure that the clinical data, the diagnosis information that you're providing to SMART is accurate and is aligned to the service, the drugs, the labs, and any other service that you're going to provide to that. This, of course, is going to increase diagnostic accuracy. We are going to allow you personalized treatment plans. So this means that if I, as Isaac, visit the facility, you will be able to have my information, and using the AI tools that are providing on Smart Online, you will be able to make better decisions, better treatment plans for the patient that you are accessing the system. Of course, we need to have predictive analysis. So this means that when you're putting symptoms and services, the system is going to guide you in the diagnostic processes of that disease. Of course, we are being very careful with the clinical part of AI, but we are not, ultimately the doctor decides, but we are going to make it easier for them. AI is also going to help us when it comes to telemedicine and telehealth. When shall we allow smart members to visit you virtually? Shall we allow members to not really come to you physically, but be able to experience the same services that you provide from the comfort of their houses? Can someone come to the child, send a photo to you, and you are able to diagnose them and tell them accurately their diagnosis and provide a treatment plan from all over? Of course, the advantage of that to you is that you're going to have an expanded market. You're going to have, of first moment, because people are going to be seeing you at any point. Also, you're going to be able to provide this 24 hours to any person anywhere in the world. That is one of the major advantages of AI. So the other thing is we are going to optimize the processes that we currently have. The pre-op process, we have put a pre-op process on Smart and have gotten a very good feedback from you people. And we are going to improve it more on this Smart Connect platform. We are going to have better pre-op processes. This is currently being done. And of course, with the engagement of all other stakeholders. We
The information that is out there for you, that belongs to you, has actually originated from you. That is your profile. And we are going to display this to all 1.8 million members on Smart on that. So you can imagine the visibility that we as Smart, the service providers. Payment tracking, as my colleague Esther had said, we are going to show you at what stage is a claim at. We have been, through our rigorous support, we were able to know that what are the pain points during payment. Is that you will be able to submit claims worth $1 million. The insurance pays you 700,000, but they don't tell you which claims they have paid, right? So the recon process is usually so difficult for you. So if we brought a system where you'll be able to track your claim, knowing that this claim is at this point, this claim has been submitted to the insurance, this other claim has been paid, this claim has been paid 50%. So if you combine this to the AI that we had provided you during billing, we anticipate to have 100% of your claims being paid. Sharing. There is something Mheshimiwa CC said. If you visit a hospital and you go to another hospital, do you need to do a lab test again? I believe everyone here knows that process, that you do a test and you go to request the same test. So what would happen if digitally we can be able to share your lab results that were done at hospital A to maybe modern Aberdare, where you have gone at that point? Wouldn't that save the patient, save you time? So we are going to have that on this platform. Again, you are partners as hospitals. So we get a case where you are looking for an ambulance. Maybe yours has gone somewhere. If you can be able to log in somewhere and immediately tell that the hospital that is 2 kilometers from me, their ambulance is available. That is what we mean by information sharing. You have a patient who needs blood. Where do you get that blood? You start making calls, you start getting all getting the patient to look for blood for themselves. But if you can be able to tell that there is a blood bank at this hospital, that would be very easy for you. So that is the type of information we want to share. So you will be able to get a resource, know where it is, know the status of that resource, and the availability of that resource. Be it an ICU bed, you could be looking for an ICU bed, but you taking your patient from here all the way to Nairobi to get an ICU bed. And maybe that ICU bed is available in a hospital that is near you. That is what you mean by information sharing. Of course, that is going to be informed by the hospitals. The consent is going to be given by. Finally, on providers, is you're going to give you data insights. So currently, as my colleague Esther was saying, if someone at your hospital does billing and they don't capture the correct diagnosis, can you be able to tell who it was? Or did a wrong billing? Can you be able to tell who it was? So what we are introducing is user management on Smart. So you will be able to know who. We give you logs as the administrator or the executive of the hospital. And we tell you that it was cashier 1 who billed the patient. So you'll be able to track the usage and the behavior of the system. Again, we are going to give you pair behavior. Pair behavior means that if you submit your insurance to Mutual, to Jubilee or any other insurance, if we give you analytics telling you that this insurance pays you in 30 days, well, this one pays you in 60 days, that would inform a decision from your side. So those are a few of the advantages that we are going to bring for Connect. And of course, not to mention there will be East implementation. So currently, if we need to do an upgrade on Smart, we will have to send Caleb and Terry to site to come to that implementation. But if it is a web-based system, we will be just doing that upgrade from Nairobi. We just click a button, and when you log in, you have the latest version of SmartLink. So those are just a few of the advantages that you're going to give to the healthcare providers. For the members, very quickly, they will be able to locate you, locate your services and the profile that you had set. Of course, access to medical records. Currently, even as a member, my records are usually restricted by the hospitals. I cannot get all those. But if I had a profile where I'll be able to know, at this stage, I went to this hospital, this is what was done. If I have all that in one platform, it will be, of course, very efficient. Self-registration. We're going to provide a lot of convenience on self-registration, as I have explained. Cost tracking and utilization, and also engagement. So with this Smart Connect, the interaction that the platform is giving with the Smart Access application is going to be one ecosystem, such that we can be able to expose your queues, the queues at the hospitals, to the member. That means I don't need to stay in the queue waiting for my turn. Imagine if you can be able to reduce the queues at your provider, such that the member just comes when they need to go to the doctor. They'll be able to know at triage, there are 3 people in front of me. At consultation, there are 4 people in front of me. That would save a lot of time and go do other things. There is referrals. Waziri had spoken about referrals. How are we managing referrals currently? It is majorly a paper process. So we are going to automate that process. So in conclusion, innovation is not a destination. It is a continuous journey marked by vision, dedication, and most importantly, collaboration. So at Smart, we have the technology, and you have the expertise and the knowledge. We are not doctors, you are. We provide the technology, you bring the knowledge. And this combination is a guaranteed recipe for success. So this is a call to collaboration between SMART and you hospitals. When we bring this very innovative and very advanced solution to you, please, as you have always, we shall partner to make your work easier. As you have always supported us, please accept this solution that you're going. So let's persist in pushing the boundaries of what's possible, because we all have a common goal. All of us want to have a healthy nation. So with that, thank you for your commitment and collaboration. Thank you very much.
own head barrow. I would like to give an opportunity to one post director also are creative when it comes to award. She was the winner for the hit. Very bigger as she comes just to say hello. Very
Good afternoon. Take you to the next level in healthcare. We are completely committed to transforming healthcare delivery with our digital solutions. And that goes to say that we are completely committed to you, because you're the people who are providing the healthcare, and we're the vehicle that is actually going to help you deliver it, transform it seamlessly. So I want to take this opportunity to thank you all so much for coming. Some people have come from Moyale, some people have come from all the way, I think Nanyuki I had as well. It's such a great pleasure to know that you really truly honor the service that we give you and the solutions that we give you. Allow me to say that we also have a very dedicated team at SMART, which is the reason why we're here. No business without people. There is no achievement without people. And it doesn't scare me when we talk about AI, because AI is absolutely nothing without people. The only reason you have had that solution that we have been presented to here on how we're actually now going to upgrade healthcare to the next level through AI is because there's people who are able to direct it. And so allow me at this point to invite you to this forum of ours. Feel free to interact with our SMART heroes. They have what it takes to take you to the next level. Everyone here is fully equipped, not just to offer you these solutions that we have presented here, but with a lot of other solutions and also with a lot of consultancy around anything technology. Feel free to indulge with them. I have 120% confidence in the people that we have brought up here to this forum to support you. Karibuni sana. It's an honor, and thank you so much for the ambush. I feel absolutely techie and geekish. Thank you.
Thank you, Mary. That is a good feel because you definitely are in the leadership of a tech company. And I like what you said, that definitely AI is not going to replace people. It's to empower them to be able to work together. So keep in step with smart applications so that you can be able to be part of the digital transformation. Let's appreciate Mary one more time. Asante sana. This is an intermediary in the program. And one more intermediary before we call the next speaker. I would like to call upon a man who has been in the optical field here in Mount Kenya region for over 25 years. He has 6 branches in the Mount Kenya region, 2 in Embu, 1 in Nanyuki, 1 in Meru, 1 in Nyeri, and 1 in Isiolo. He is the director of at Kiri Mara Opticians. Ladies and gentlemen, I have the honor and the privilege of calling upon Dr. Vimal Chada to come forward and say hello to the delegates here. Let's appreciate Dr. Vimal. Thank you. We are glad to have you here, and welcome again.
Asante sana. It is a smart move by the smart team, isn't it? You don't want to say yes. Why? You know, HR was given the job without an appointment. Sindio, also mean a let you happen na you. Sindio, so can you clap for the smart team for doing the smart work? Ready for any opportunity to be given. If you're not opportunist, you don't have been land of opportunity, which is Embu. Embu is a land of opportunity. So when the opportunity comes, you must go for it. Don't shy anymore. Now let me appreciate the smart management to talking to the stakeholders. Bana Isaiah, Madam Mary, Esther, Purity, I got all those names on first hand, on my fingers. Why? Because I make an effort to meet them. Now, all these service providers are face of smart on the ground. Madam Esther, you must appreciate that. All these service providers sitting here, they are working on behalf of smart on the ground. So your clients, insurance industries, those who are network, partnership, collaborations, they succeed. But one thing is very technical in this world of God. Wi-Fi napotea, hakuna kitu nakuja hapa, si ndio? So system down has to be addressed. Sometimes we feel the challenges, the system is down. People may not come out and say clearly to you, but it's good to communicate, is very important. Number 2, want to appreciate your sport team on the ground in Mount Kenya region. Whether it's a Caleb, Charles, Terry, they're doing wonderful job. I think all these people, those who have come together today here, 162, I was given the number, those are seated here. So if these 162 have come from various facilities, they're able to witness the strong support on the ground to enhance the service delivery to the clients. I always tell the KRA, PAYE means pay attention to your employers. Pay attention to your employers, because we are the employers because we pay the taxes. If we don't pay the taxes, the county government, national government on their knees. If the insurance industries are smart, don't give services on time, they have no business to operate. Is it true? So my focus is on two things. Number one is service delivery. And what we have done, innovation in that digitalization, I think it is going to save a lot of time on service delivery, because what citizens are looking for, only one thing, instant services. Sindio, napatia M-Pesa, napata chakula. Sindio, but bada hai kazi. Sindio, you eat the food and you pay by M-Pesa. Innovations are good, but there are some crooks also in the industry. I want to put the word crooks. Those who play with the minds, because we move to integrity. Integrity means what on a kuno chai, Sindio? How many have taken tea? Very few, only front people. Rest have taken coffee, Sindio. Now I will give the definition of chai and coffee. Yeah? Madam Esther, it will help you in your industry. Chai means corruption hurts. CH, corruption hurts accountability and integrity. AI, corruption hurts accountability and integrity. But those who have taken coffee must have been working with the civil servants. They have been civil servants. This is for a joke, huh? Don't take it seriously. Coffee means corrupted officials. They are free and fair, effective and efficient. Sindio? Kama nendo ko ofisi ya ndugu yangu naitwa Mr. Ion namaliza kazi, halafu nasema sasa muhindi iko saa ya lunch sasa. Mandasi nunue chai. So he give me his character. Sindio? Namna gani? So don't be now. You're going to be given lunch at 6 o'clock. Huh? Are you ready for 6 o'clock lunch? Hello, how many are ready? Weka mkono juu hata moja bili. Chai napata saa sita, si ndio? Lunch napata saa ngapi? You know who is responsible for that? Those who have sit behind, those who came late. They have delayed this process. I'm sorry, I'm giving a very clear message. Let us become TKK. Time keeping Kenyans. TKK means time keeping Kenyans. If you have kept the time, you could have given the tea by 11 o'clock, 10:30. My brother was waiting, all be full, then we tell them to start cooking. So with these few remarks, to say
you.